to primary effect. Example, a cortisol secreting tumor on the adrenal gland. It is also due to secondary effect, usually due to ACTH secreting tumor of the pituitary gland. It may cause because people take glucocorticoid hormones. May be caused due to overproduction of cortisol in the body. So what are the symptoms and effects of Cushing syndrome? The increased catabolism may produce such a large quantity of precursor of hepatic gluconeogenesis that the blood sugar level increase as observed in diabetes. The increased blood level of cortisol tend to promote uncontrolled catabolism of bone, muscle, skin, and other organs. The bone strength diminishes and can lead to osteoporosis, muscle weakens, and skin becomes thin and easily bruised. There is a possibility of immunosuppression which is brought about by the anti-immune action of cortisol. The effects and the symptoms and effects is that it is associated with the loss of fat mass from the extremities and with the redistribution of fat in the trunk, face, and back of the neck. Obesity can occur. A possibility of developing hypertension due to the pharmacological effect of cortisol, including cortisol's ability to potentiate the effects of epinephrine and norepinephrine on the heart and blood vessel. So, most symptoms and effects, most people have severe fatigue, weak muscle, high blood pressure, and high blood sugar. Women usually have excess hair growth on their faces, necks, chest, abdomens, and thighs. Their menstrual period may become irregular or stop. Men have decreased fertility with diminished or absent desire for sex. So it can either be emotional disturbance, enlarged silla turnica, moon face, osteoporosis, cardiac hypertrophy, hypertension, the buffalo hump, the obesity, the adrenal tumor or hyperplasia, thin or wrinkled skin, abdominal striae, amenorrhea, muscle weakness, purpura, and skin ulcer, poor wound healing. So that's the cause of the Cushing syndrome. So treatment depends on the specific reason for cortisol excess and may include surgery, radiation, chemotherapy, or the use of cortisol inhibiting hormones. So now let's talk about the diabetes mellitus, often referred to as diabetes. It is often referred to as diabetes. So it is a group of metabolic diseases in which a person has high blood sugar level either because the body does not produce enough insulin or because cells do not respond to the insulin that is produced. There are three main types: type 1 diabetes, type 2 diabetes, and gestational diabetes. So first, we must discuss what is insulin. So insulin is the principal hormone that regulates uptake of glucose from the blood into the most cell, primarily muscle and fat cells, but not central nervous system cells. Insulin is produced by special cells called beta cells in the pancreas. Pancreas is found mainly behind your stomach. Therefore, deficiency of insulin or the insensitivity of its receptor plays a central role in all forms of diabetes mellitus. Insulin is also the principal control signal for conversion of glucose to glycogen, storage in the liver and muscle cells. So, type 1 diabetes mellitus is characterized by the loss of insulin, producing beta cells of the islet of Langerhans in the pancreas, leading to insulin deficiency. This type of diabetes can be further classified as immune-mediated or idiopathic, where beta cells loss is a T-cell mediated autoimmune attack. Beta cell produce little or no insulin, and as a result, glucose builds up in the bloodstream instead of going into the cells. So what are the type 1 diabetes? So the stomach changes food into glucose, where glucose enter the bloodstream. Then the pancreas makes little or no insulin. The next step is that little or no insulin enter the bloodstream, and then glucose builds up in the bloodstream, and that's how it works. So, type 2 diabetes mellitus is characterized by insulin resistance, which may be combined with relatively reduced insulin secretion. The insulin receptor are believed to be the defective responsiveness of body tissues to insulin due to the insulin resistance, which means that the fat, liver, and muscle cell do not respond correctly to insulin. The blood sugar does not get into the cell to be stored for energy. When the sugar cannot enter the cell, there are high levels of sugar build up in the blood. This referred to hyperglycemia. So, in the early stage of type 2 diabetes, the most predominantly abnormality is reduced insulin sensitivity. Hence, at this stage, hyperglycemia can be reversed by a variety of measures and medication that can improve insulin sensitivity or reduce glucose production by the liver. The type 2 diabetes usually occurs slowly over time, and most people with the disease are overweight. Increased fat makes it harder for your body to use insulin the correct way. So, the type 2 diabetes process is that stomach converts food to glucose, which glucose enters bloodstream. Pancreas produces sufficient insulin, but it is resistant to effective use. Glucose unable to enter the body effectively, which glucose level increases. Let's take a break. Okay, this is the last part. We have the gestational diabetes. This type of diabetes only occurs in some women during pregnancy. For moms to be, the body needs additional insulin. Therefore, the pancreas dutifully secretes more of it. However, if the pancreas can't keep up with the increased insulin level, the blood glucose level rises too high. Between 2 and 10% of expectant mothers develop this condition, making it one of the most common health problems in pregnancy. Most women don't remain with gestational diabetes after pregnancy. Once someone has had gestational diabetes, she is at a high risk for getting aging during future pregnancy and for developing diabetes later in life. If untreated, gestational diabetes can damage the health of a fetus, and such risks include macrosomia or high birth weight, congenital cardiac and central nervous system anomalies, and skeletal muscle malformation. Which the process of it is that the high blood glucose levels in mother brings to extra glucose to baby, which causes baby to put on extra weight. So, the signs and symptoms of diabetes. Symptoms may develop rapidly, weeks or months in type 1 diabetes, while in type 2 diabetes, they usually develop much more slowly and many be subdued or absent. Classical symptoms are polyuria, frequent urination, or polydipsia, increased thirst, and polyphagia, increased hunger. Changes in the shape of the lenses in the eyes resulting in vision changes. People may also present with diabetic ketoacidosis, a state of metabolic dysregulation characterized by the smell of acetone. A rapid deep breathing known as Kussmaul breathing. Nausea, vomiting, abdominal pain, altered states of consciousness. Main symptoms of diabetes. This is what we're talking about. In the central nervous system, we have the polydystia, polypadias, lethargy. Yeah, this cannot be read. So, yeah. So we have to comparison the type 1 and type 2 diabetes. The type in the onset, the type 1 diabetes is sudden, while in the type 2 diabetes is gradual. In the age of onset, in the type 1 diabetes, any age, mostly young, while in the type 2 diabetes, mostly adults. In the type 1 diabetes, the body habitus is thin or normal, while in the type 2 diabetes is obese, often obese. In the ketoacidosis, type 1 diabetes is common, while in the type 2 diabetes is rare. Autoantibodies in the type 1 diabetes, it is usually present, while in the type 2 diabetes is absent. The endogenous insulin is that in the type 1 diabetes, low or absent, while in the type 2 diabetes, normal, decrease, or increase. Concordance in identical twin is that the type 1 diabetes may be 50%, while in the type 2 diabetes is 90%. The prevalence of it is that it is less prevalent in type 1 diabetes, while in the type 2 diabetes, it is more prevalent. Between 90 to 95% of you is diabetic. So, psychological stress related to diabetes. When you stress, your blood sugar levels rise. Then stress hormones like epinephrine and cortisol kick in, since one of their major functions is to raise blood sugar to help boost energy when it's needed most. Think of the fight or flight response. You can fight danger when your blood is low, so it rains to help meet the challenge. Both physical and emotional stress can prompt an increase in this hormone, resulting in an increase in blood sugar. People who aren't diabetic have compensatory mechanism to keep blood sugar from swinging out of control. But in people with diabetes, those mechanisms are either lacking or blunted, so they can't keep a lid on blood sugar. When blood sugar levels aren't controlled well through the diet or medication, you're at higher risk for many health complications, including blindness, kidney problems, and nerve damage, leading to foot numbness, which can lead to serious injury and hard-to-heal infection. Prolonged elevated blood sugar is also a predecessor to cardiovascular disease, which increases the risk of heart attack and strokes. Anything upsetting like going through a breakup or being laid off is certainly emotionally draining. Being down with the flu or suffering from a urinary tract infection places physical stress on the body. It's generally these longer-term stressors that tax your system and have much more effects on blood sugar levels. Diabetes known as symptoms are always tired, sudden weight loss, wounds that don't heal, frequent urination, always hungry, sexual problems, blurry vision, vaginal infection, numb or tingling hands or feet, and always thirsty. And we're just gonna break in here. So, let's talk about the bone growth actually. So bone is a special connective tissue made up of several cell types surrounded by a collagen matrix called osteoid, upon which are deposited minerals, particularly the crystal of calcium and phosphate known as hydroxyapatite. A growing long bone is divided into the ends or epiphyses, and the remainder, the shaft. The portion of each epiphysis that is in contact with the shaft is a plate of active proliferating cartilage known as the epiphyseal growth plate. The epiphysis is at the end of the bone, which the shaft is in the middle, the epiphysis is at the end. The epiphyseal growth plate are the one on the lines in the epiphysis, while the marrow cavities are the buslot. There are three types of bone cells. We have the osteoblasts, osteocytes, and osteoclasts. So osteoclasts are like combs shape, while the osteocytes are circle, but it has more like in the middle, like look like a nucleus. The osteoblast on the other hand is a circle but more on the smaller things, while the calcified matrix are the spaces. So let's talk about the osteoblasts, which are the bone-forming cells. They secrete collagen to form a surrounding matrix, which then becomes calcified. Once surrounded by calcified matrix, the osteoblasts are called osteocytes. The osteocytes have long cytoplasmic processes that extends throughout the bone and form tight junctions with other osteocytes. Osteoclasts are large multinucleated cells that breaks down previously formed bone by secreting hydrogen ion, which dissolves the crystals, and hydrolytic enzyme which digests the osteoids. At the shaft edge of the epiphyseal growth plate, the osteoblasts convert the cartilaginous tissue at this edge to bone. while new cartilage is simultaneously being laid down in the interior of the plate by cells called chondrocytes. The epiphyseal growth plates remain intact. Actually, it usually widens and is gradually pushed away